Jessica Chalk's fertility journey has not been easy.
We had a pretty devastating miscarriage on an IVF transfer round that ended up working, and then we lost our twins at 10 weeks. And that miscarriage ended up just not going well. And then I had issues with my uterine lining.
In search of answers, she went to a clinic in New York City, content to pay out of pocket to speed up the process, instead of potentially waiting more than a year for different tests and procedures.
I leveraged and used US where I could to fast track an otherwise long wait, and in other parts to access treatment that just wasn't available for me at the time in Canada.
Firefighter Steve Romanowicz received a portion of his cancer treatment stateside. At the time, the CAR T therapy was not available in Canada. It was an option that was financially possible given his insurance tied to dangers of his job.
A couple of months prior that they had told me to get my affairs in order. So in all likelihood, I would not be here today. WSIB recognized that the treatment was a good option for me.
A new report from the Fraser Institute says in 2025, more than 105,000 people traveled outside Canada for care, with Ontario, British Columbia, and Alberta having the highest numbers.
Canada has the longest waiting list for healthcare in the developed world, and we're the only country that has no private alternative to the universal scheme at home.
A hybrid system that includes both private and public options is something orthopedic surgeon Dr. Brian Day has long championed. More than 23,000 people died waiting for treatment in Canada over the span of 1 year, according to a recent report from the think tank Second Street.
Out of 10 countries developed countries with universal healthcare, we are at near the top in spending and near the bottom in performance. Most tellingly, it's at the bottom in access to care for low-income groups. So it's not doing what theory is supposed to have achieved.
An issue researchers say is becoming increasingly critical.
The Canadian healthcare system is failing Canadians on a daily basis, whether it's the 100,000 plus Canadians who left the country for treatment or the Canadians who are walking out of emergency rooms because they can't get the healthcare they need.
Katherine Ward, Global News, Toronto.